I saw a little post flyer come through about some movement in Australia of somebody wanting to get parental alienation behaviors identified as child abuse. Why? If you just, a shared persecutory delusion is child psychological abuse. You already have it. Just switch to using a shared persecutory delusion as your construct rather than parental alienation, and you have it right now, today, February 19th, 2023. You have that the pathology is child abuse if you just use the real terms. They don't. They're locked into this parental alienation thing from their own needs, and so it just continues, no solution, because there's no way to diagnostically define parental alienation. Give you an example. I was reviewing a custody evaluation. The custody evaluator, stupid, ignorant, no knowledge applied, but the pathology is clearly present. I'm reviewing that, documenting everything, and when they reach their conclusions, their ignorant conclusions, they cite Burnett and Demosthenes Lorandos. They cite their article about five-factor PAS to say there was no parental alienation. And that's what I see all the time. If you use the word parental alienation, they'll just say, oh, we looked at parental alienation and there was none. And what can you do to fight back on that? You can't, because that's just an opinion. There's no diagnostic criteria that's any established. If they say there's no persecutory delusion, now you can say, well, would you think it's true then? Well, no, it's their belief that they're being malevolently treated is not true, but it's what the child believes. Well, that's a persecutory delusion, isn't it? If it's not true, it's false, and then how false? And you can use a mental status exam. Mental status exam, the reason I put that in, because that's the final hammer on these mental health people, because the differential diagnosis is a potential persecutory delusion. And so that requires a risk assessment. Either it's going to be child abuse by one parent, targeted parent, or child psychological abuse, shared persecutory delusion by the other. Now, the assessment for a shared persecutory delusion is a mental status exam of thought and perception. But I know none of these mental health people in the family courts know how to do that, because the only people know how to do that are over in schizophrenia, and they're not working the family courts. So I know that. So I know for a fact that they are all practicing beyond the boundaries of their competence, all of them. Now, if they're going to argue with me about that, well, then conduct a mental status exam of thought and perception. If they don't, they'll say, well, we don't know how to do that. Then they have a choice. They can either learn how to do that, go away, learn how to do that, and come back, according to standard 2.01A, or 2.01C and D says they should be consulting. Who should they consult with? Me. I've got that background. I've got attachment background. They don't have attachment background. I have factitious disorder imposed on another. I have child abuse and complex trauma, and I have 10 years in the family courts. So I have that professional background in delusional thought disorders. What I would tell them to do is not the mental status exam. Yes, if they can, but there's 3 diagnostic indicators: collect, checklist, check, check, check. Are these 3 present? And 12 associated clinical signs. If you gather those symptom information, then you can make the diagnosis based on those symptoms. So I'm kind of scaffolding them up. But if they don't want to listen to me, well, then do a mental status exam of thought and perception. But you need to do a proper risk assessment for possible child abuse when the differential is child abuse. And so we can get to the mental status exam and that leverage if we use a persecutory delusion as our construct. If we use parental alienation as a construct, you lose it. You lose any accountability and any ability to hold the professional accountable. And so the use of the word parental alienation needs to stop. It degrades the quality of mental health services being received by family, and it's a completely failed diagnostic model. 40 years since 1980s, it's given us this ignorance and incompetence and unethical practice. This is the product. What you're seeing is the product of trying to use this new pathology of parental alienation. So don't do that. But if you do, you're on your own, because the rest of us are going to be moving towards more established constructs.